Increased bacterial resistance is being seen with antibiotics, and that will predispose people because there's a drug failure to clear the pathogen. Recurrent UTIs are commonly seen in sexually active women without any identifiable structural abnormality or other predisposing conditions. The lesions can occur, and then these can start to lead to lack of clearing and more recurrent UTIs. So it could be bladder stones, anyone who has to get calved or have a stent inside or any kind of foreign material in there, all going to increase things. When there's a mass or pre-cancer or even a neoplasm in the bladder, that's, of course, increasing risk. And it's sort of a vicious cycle. Recurrent UTIs are actually associated with bladder cancer. Not fun. That's definitely one condition I hope never to ever be affected by. So ureterococcyles, urinary fistulas, and then kidney stones, urolithiasis can contribute to UTIs, bladder stones, urolithiasis. All of these do affect both kids and adults. And one we're going to go over risk factors. The biggest one I feel is the terrain, because the gut is the largest terrain and it informs everything else. And the gut terrain is informed actually from head down, sinus, ear, nose, throat. Every time, we see cavities, what happens? We know it also ends up in the gut. There's bad strep and other flora that are around the tooth and the root of the tooth. And then if someone isn't clearing periodontal disease and gum disease and mouth disease, oral cavity, microbiome problems, we always, dentists, good biological dentists, always look at the gut because it's two-way. So, of course, risk factors are recent antibiotic use, anything that breaks the gut, so that's birth control or drugs like leuprolide and any kind of IUD. All these are, even if they're copper, we're seeing that affecting the gut, copper toxicity. And again, estrogen is protective for the gut. It's also protective for the bladder and also the vagina. So these are all the risk factors. A lot of these we went over already, very similar. Interestingly, genetically, they saw a mother or sister who also has frequent bladder complications like recurrent UTI. I think it's maybe household or, genetic, just like we went through some genetics for issues. Could be, FUT2, where you don't make good, have attachment of flora to the prebiotics that we make on our own on the mucosal lining, so we lack that protection. Could be an MBL, a mannose-binding lectin, genetic defect, where we can't ward off fungal elements unless we eat a lot of fiber to compensate for that. And of course, personal hygiene is really important. I think all men and women, they're taught, to wipe correctly. For women, especially, wiping front to back, not backwards like that. Washing hands, all the natural things. I know in some countries they eat with their hands, one hand, and then they, clean with another. I don't know if that's actually healthy and they get less UTIs. I wonder if they're getting protection if they have really good, gut microbiomes. I would love to hear how that drills down. So we can see how there's so much connection, and we already know that there's a big connection between rectum and gut microflora, how it transmits and ascends to the vagina, but also happens also to the bladder. And you can see how this is pictured graphically. So in the Western world, for UTI treatment, both acute and recurrent, really there's just a lot of failures, to the point where the algorithms are saying to use non-antibiotic considerations and prophylaxis with probiotics. Have you ever heard that? Yeah. And the probiotics, I wish I had good studies to go over. I don't really have any today because they're all really low dose. They don't have curing rates of 80, 90%. They're all low rates, so I'm not really going to spend that much time on it. But for recurrent UTI, they even suggest checking the partner and having some really good evaluation of that. I totally agree. Any kind of recurrence means there's definitely a lot more complication going on. So here's non-antibiotic algorithms that are even, aimed at Western doctors. I love it. So there is a meta-analysis with 772 patients included. It's 9 studies, and the average age was 34, with men and women, mostly women, I think, age 18 to 65. two of the studies showed that probiotics could definitely reduce the risk of UTIs, but the rest actually didn't have that conclusive of a result. What they did find was there was like very few side effects. That's great. Compliance was pretty good. I think the vaginal infection probiotic studies were way better. I always think these limitations are related that they don't use a high enough dose, because with even with FMT, even that they didn't see full, improvement with recurrent UTIs, but they just saw an improvement a little bit. But I think it has to be very holistic in the approach, where it's looking at the whole microbiome and the terrain, not just the bladder, but a feeding, seeding, weeding, type of approach. So there is an over-the-counter antibiotic. It's an antiseptic, and it's more bacterial static. So it doesn't cause any development of antimicrobial resistance. So this is definitely a safe recommendation. It's now available like for the last couple years in every major drugstore. It's called methanamine, and it does, target in the gut, in the bladder. It tends to, concentrate there, kind of like a lot of our antibiotics. And it's a cyclic hydrocarbon. If you look at this chemical formula, does anyone recognize it? It breaks down to formaldehyde. So it's not really to be used forever. We don't want to preserve our bladder, but drink lots of fluids that's a recommendation, I would say, to flush all the aldehydes out. So in total, there were a lot of studies done, 13 studies with 2,032 participants total. And this was very effective, especially when the patients added something, an adjuvant like vitamin C, or they used sodium acid phosphate to acidify the urine. And the doses used were 1 gram to 4 grams. And I like to, if I use this with clients, I actually have them double the over-the-counter dose. It's pretty safe. The studies show it was very safe, and absolutely no drug resistance seen with it. For recurrent UTI, there actually are some protocols in Western, medicine, and in journals, and mostly because it's pretty safe. The mechanism is formaldehyde and ammonia. It's not, pushing any apparent selection for drug resistance. Of course, we hear about cranberry. These are proanthocyanidins. If someone develops IC, they can't really use cranberry. It's too acidic, whether it's the supplement or the juice.